desperately simple. It's really about people being able to access all sorts of things that are not drugs or procedures, which might help their well-being and also their healing. So this might be arts interventions, it might be physical interventions, it might be help with housing or benefits, it might be complementary sorts of interventions like yoga or Tai Chi. A very, very vast list of things which we now know help people both to be healthier and also if they've got a long-term disease. And there are only two ways of access. One is what we call signposting, which is when there's a menu of activities on an app or on a database, which people can access themselves through a receptionist in surgery, through other health professionals, maybe themselves. But social prescribing is slightly more specific. This is where it involves a link worker who actually connects you to these various options of activities. And the importance of that link worker, who is referred by a GP or another health professional, is that they have time to understand that person who's often at low ebb, may have low self-confidence, low self-esteem, may not even think that they're able to do these things, or and therefore with motivational training and with time and the right personality, link work is able to help people to be more active part of their treatment. Suggest options that fit with their way of life, that actually meet their hopes and expectations and beliefs, and therefore give them a very bespoke menu of activities which often bring them to a different level. And they may even go to that first reading class or dancing class or drama class or whatever with the patient, just so that they have the confidence to connect. And once things start happening, you get all sorts of effects, cascade effects. It was really almost by mistake. We were given a very large grant by Alan Johnson, who's then Secretary of State for Health, to my surgery, working with Sam Everington's and Bromley by Bow and Exeter University, Westminster University, to develop all sorts of self-care packages for conditions where conventional medicine wasn't really providing all the answers. You might imagine the list, things like irritable bowel, migraines, back pain, anxiety, depression, premenstrual tension, ME, all these sorts of conditions which aren't very well treated. And we produced lots of information showing what people could do in terms of lifestyle, in terms of conventional complementary approaches. When we came to the end of it, we decided that to just produce a video or to just produce written information wasn't really going to get the people that most needed to be helped. And that was where we invented the link worker. And Ruth, who was our first social prescriber or link worker, then we thought, well, we need to have biomedical evidence because that's the only thing that's going to persuade the medical fraternity. So we took about 150 people and we gave them an intervention which was brief, providing dietary advice, exercise, sometimes taking to the supermarket, looking at what foods and fat-free and all the rest of it. And at the end of it, we showed that we converted a third of our diabetics and pre-diabetics to no longer being so we then, at the end of that research, the person who led the research, Marie Polly, and I were on a train back to London, and we thought, well, this now needs to become a national movement. So we made ourselves co-chairs of the leadership of the National Social Prescribing Network, invited all sorts of people we knew who were already doing fantastic stuff, like Sam and Bromley by Bow, like Chris Drinkwater, who was running fishing clubs in Newcastle, like James Fleming, who had said to himself, why am I giving antidepressants to people who don't have a job? Why don't they help to get jobs? We formed a leadership group, we started a national network, and really history went on from there. We had about 3,000 members. NHS England contacted us. They said, this sounds like a good idea, can we work together? And surprisingly, within 2 or 3 years, this caught the imagination of Number 10, the Secretary of State, and the senior NHS England, and the rest is history. Now it's national policy. We now have a link worker in every primary care network to become 2 or 3 over the next 2 or 3 years, and it's now totally embedded in the system. Years and years, people have realised that the arts and exercise and outdoors are part of health and healing. I suppose historically, probably it was the Dawson report, I think in the 1920s, which started to suggest that we should be looking much more at creating health in our communities, looking outside the biomedical model. The most interesting experiment of that was called the Peckham Experiment, which was a couple of GPs in Peckham who, in their surgery, developed a swimming pool and various other facilities for their patients. They had to pay a little, but the idea was that they made the patients well, and therefore they didn't need to consult illnesses because they were more resilient and therefore better prepared for anything that came their way. Ironically, the Peckham Experiment was closed with the advent of the health services. It was felt not to be, so relevant to what was required at the time. And then I suppose there was a 50-year gap until a number of us started doing it spontaneously throughout the country. And then, as I said before, met as a leadership group, made a movement of it, and now, of course, it's part of systemically part of the health service.